Welcome everyone, bienvenidos to the first webinar session for the Latinx webinar series. Today's session is being hosted by Tanoma Consulting. We know all too well the uncertainties of quarantine conditions and stay-at-home orders due to the COVID pandemic and what they've cost in terms of significant distress and strain in all communities. But most recently, we've seen a concerning rise in the cases among Latinos, and we recognize that there are unique social cultural considerations that may increase that risk of exposure in our community, as well as an increase to the susceptibility of mental health, substance use, and other health conditions. So today's session, titled Addressing Mental Health Issues in the Latinx Community During COVID-19, will focus on mental health concerns, access to care, and resources. And we couldn't think of anyone better to partner with in this conversation than the Healthcare Alternative Systems Incorporated and Mr. Jesus Jesse Tejeda, who is the Vice President of Operations at Haas. My name is Lisa Aponte-Soto. I am the founding President and CEO of Tanoma Consulting and the lead sponsor of this webinar series. Tanoma Consulting is a national nonprofit consulting firm providing transformative, culturally responsive research and evaluation and training services to advance health, education, and workforce equity. And our mission is simple. We aim to create innovative strategies that foster equitable practices for all communities. And if you have an interest in learning more about Tanoma services and training opportunities, you can visit us online at our website at www.tanomaconsulting.com. Before we begin, we would like to invite you to use a chat box throughout the session for any comments that you have for our presenter, or if you have any technical issues. We'll also wanted to know that we're going to leave about 10 to 15 minutes at the end of the session for Q&A. So please use the Q&A box so that we can review those questions and try to respond to as many as we can at the end of the session. Also, please note that we recognize that some may not have access to the internet in our communities, for example, or may need the information provided in Spanish. Therefore, we are going to be disseminating today's discussion in different formats to share with multiple audiences. And if you have any recommendations, we're really excited to launch this series. So we're looking to learn and grow with you. So please do share. We're going to have a post-session survey, so feel free to enter that information there or reach out to us directly through our website at the Contact Us page or our email. Now, let's begin. Welcome again, everyone. Saludos a todos. Our discussion today focuses on addressing issues affecting Latinx health, particularly now during COVID-19. The session is co-sponsored by Haas, a nonprofit organization providing behavioral health services in the Cook and DuPage counties. The mission of Haas is to provide a continuum of multicultural and bilingual, Spanish and English, behavioral care and social services that empower individuals, families, and communities. And if you are interested in learning more about Haas, we're going to hear a lot from Mr. Tejeda today about what Haas does and the great work that they've been doing throughout this pandemic and beyond. But if you want to learn more directly from their website, you can visit www.haascares.org or contact their office at 773-252-3100. And without further ado, I'm honored to introduce to you our guest speaker today, Mr. Jesus Jesse Tejeda, Vice President of Operations at Haas. Jesse has 15 years of experience working at Haas, providing direct operations and consultative support across local and regional behavioral health settings. His career at Haas started as a certified alcohol and other drug abuse counselor at the DuPage site. He is noted for expanding outpatient and intensive outpatient substance use treatment programs, as well as youth programming at Haas. He has extensive experience working with diverse populations, including individuals with substance use disorders, criminal histories, and gang-involved youth. He applies culturally responsive relapse prevention therapies and trauma-informed principles for Latinx participants. He earned a master's in community counseling from Northeastern Illinois University. And in addition to that, to being certified as an alcohol and drug abuse counselor, he holds a gender competent endorsement. He is currently sits on the board of the Illinois Association of Behavioral Health, serves on the Latino Behavioral Health Conference Committee, and is a certified member of the Illinois Alcohol and Drug Abuse Professional Certification Association. Wow. A lot of great accomplishments, and those are just a few of those notable accomplishments that Mr. Tejeda has under his belt. So you can see why we're incredibly excited to have him join us today. Welcome, Jesse.
Well, thank you for having me on here, Lisa. I really appreciate to be on the first webinar, and I think I could take off this mask for today. How's that? So you guys able to see me and hear me okay?
Yes.
Okay, beautiful. So thanks for having me on today, Lisa. Really appreciate it.
Thank you for joining us. And to get started, we would like to really simply learn more about what Haas is doing. So if you could share a little bit more about what services you currently provide.
Sure. So healthcare alternative systems have been around for 45 years in the community. We started here at our headquarters, which is Armitage, California, in Humboldt Park. And then from there, we expanded as far west as DuPage County. Initially started with the need in substance use treatment here in Humboldt Park, specifically with the Latino community. At the time, there was no providers that provided culturally competent services, let alone bilingual services. So it started off a conversation between two individuals that had alcoholism in their background. So the agency started from that conversation. And now we're as far west as DuPage County, out in Wheaton. We have a location. We have a total of 10 sites throughout the Chicagoland area, including Wheaton. We provide mental health, substance use treatment, both in outpatient and residential services. In addition to our behavioral health services, we also have a medication-assisted treatment program where we provide alternatives to individuals that have opioid use disorder. That program's on the west side of Chicago, but we're very proud of that project, especially with the opioid epidemic that we've been hitting. Primarily, we provide services to the Latino African American community. As you all know, there's been a lot of gentrification, so the neighborhoods have changed, and as a result, the agency has had to adjust not only in the services, but in our competencies and our ability to continue connecting with the communities that we're in. So, for example, here in Humboldt Park, as you all know, it's been a big shift. So right now, most of our Latinx community is coming from the Belmont-Cragen area, where we have a domestic violence program, substance use services, and mental health programming as well. And those services are much needed in the area, especially what we're seeing today. And on the screen, you see a whole list of services that we have. And like Lisa said, if you have any questions, feel free to reach out to me about the agency or any of our services.
Great, thank you, Jesse. Now, since the onset of the COVID-19 pandemic, what do you feel has been the biggest challenge that you've encountered in serving your clients?
So it's been twofold. One is internally, so with us, March 15th was a date that sticks in my head, because that's when we went officially from stopping all face-to-face services. And that was, in response to make sure safety responses for our staff and also for our participants, our clients. So what we did was we stopped all face-to-face services and quickly pivoted over to providing telehealth services. And the challenge with that is the equipment, number one. The equipment wasn't installed in most of our sites, but we were able to get that slowly. Now it's coming in, but the cameras were impossible to get initially. So technical was the biggest challenge. Second was also many of our clients. They also were very confused as far as what to do next, what was being offered, where can they go for different services. Their needs changed simply. So it was a lot of case management that we did. And that was with a lot of our families and our youth. Many of our clients have family that are in school, for example. And so a lot of those, their employment and education really threw their schedules and their lifestyle into a tailspin. And then ultimately the financial, it's the whole human service infrastructure, especially, unfortunately, when we have crises, that's where you see the discrepancies in resources. And this is no exception. So financially, the whole human services infrastructure has taken a tremendous hit. And it's going to take a while before agencies like Haas and other providers get back to doing things or getting back whole. So there's been a few challenges, but slowly we're adjusting. Our number one priority is continue providing the services for our participants and to make sure those services are not disrupted as much as possible.
Thank you. Would you say that there are any particular shifts in how you've had to respond to the needs, internally in terms of the infrastructure or your day-to-day operations?
Yeah, so most of our staff, at the beginning, all of our staff started working from home. We made sure that the staff had the equipment to work from home to provide telehealth services. And then we shifted a lot of our resources towards reaching out to their clients. So we had to make sure we had the staff at the front lines making the phone calls. At times we had to go visit our participants and clients and go knock on their door to make sure they knew that the services were going to continue and here was their information. So a lot of our staff had to be reassigned or had to engage them in doing other things and other tasks that we had to do to make sure that we engage our participants. But that was the biggest shift is how we were delivering the services and making sure that staff received the proper supervision while at home. And for a lot of staff, it's a big shift. They're not only the supervision, but the support. So you have those two polarities that are existing as care for self and care for others. So many of our staff struggled balancing that. And so we had to make sure that we continue providing that support to them and ourselves to make sure, because if we're not healthy, then, we can't be much help to our participants. So we had to simultaneously make sure we're taking care of ourselves in the community. So it was a shift. Right now, 2 months into this, we're adjusting now. And I could probably say that for most of our participants, their services haven't been interrupted because of the shifts we did internally. So I'm very grateful that has occurred.
Yes, and it's so heartwarming to hear the efforts that you are investing in towards ensuring that your team feels supported throughout this process. I think it's sometimes it may be a little bit undervalued in terms of the impact that it's also having on staff, especially those who are essential workers or are in the front lines. So right. Yeah, thank you. Now, we know all too well, as you mentioned, that Haas predominantly serves Latinx and African Americans, 75% from what I know. And these are individuals, I think it's important for those joining us today to know, that are from some of the most impoverished communities in Chicago, across the Cook and DuPage counties. Over 95% of those individuals that you serve as clients, I think you have well over 6,000 clients served as of last year alone, are coming from low-income communities or reporting no income. Over 95% of those individuals are also reportedly uninsured or underinsured, which really makes us pause because we know it's limiting their access to healthcare services. And you are all, you have been sort of that front runner and leading agency in the community in terms of bridging that gap, especially now more than ever during COVID, that we're seeing most recently, right, increasing awareness around the elevated numbers and rates around African Americans and
Right.
Latinos having the highest rates or cases of COVID-19 or testing positive, basically, in terms of what that means. I think one day last week it peaked as high as 60% for Latinos, and you know it's sad to hear for all of us, right? But we know that beyond COVID, it takes a toll on our mental health. Social culturally, there are certain aspects of our community, right, in terms of us wanting to be by nature very collectivist or very, you know, familismo, right, to have that family and celebration or celebratory experiences to share and cohabitate and just, you know, be with each other. We recently had Mother's Day, for example, but you know, just to touch specifically to the issues, we know that our communities are already disproportionately affected by anxiety, depression, post-traumatic stress disorder. We hear of susto and ataque de nervios, and just wanted to kind of get a better sense in terms of what you're seeing in terms of the clients that you serve. Are you seeing more elevated cases of individuals, particularly from the Latinx community, in terms of their mental health support needs?
Sure.
How has that specifically shifted in terms of those types of support services?
Sure. So one of the sites that I mentioned that we have, so you covered a lot of things there, so that we could talk about.
Didn't I?
Right. So you're right.
But we can start touching one at a time. Let's talk about just you know, how have you had to respond to just social cultural needs, for example?
Yeah, so we're seeing a couple of things, and specifically with our Belmont Creighton site, where I'd say over 70% of our population over there is Latinx. So we're seeing with many of how the families are dealing with their participants is you're seeing two extremes. One is that there's nerviosismo, this susto, this miedo of what's happening, the misunderstanding of this illness. And then you see this other extreme with, you know, it's not a big deal. It is what it is. I'm just going to deal with it. I still have to work. Where you see these two polarities existing in one family. And so we've had some individuals that have tested positive for COVID, and their support system is broken in half because they may get the support they need from some of the family, or they may just not even be there physically. And you feel helpless. So you hear feelings a lot of helplessness because, you know, we're used to, like you said, a lot of us are used to with go showing support of our family. When someone of us gets sick, we go visit them, we go take them something to eat. And in this, you know, we're strongly urged against it. So you're seeing a lot of those kind of anxieties and nervousness when something happens like this in the community. Another thing we're seeing is we're seeing an increased use of substance use disorder because many of these, COVID has brought up many triggers. For example, isolation is a huge trigger for many individuals that are struggling with substance use disorder, especially in our community. It's huge. Another thing we've seen increases is domestic violence, unfortunately. And that has been an issue with the majority of the women that we serve in our Belmont Creighton community that have domestic violence issues. We are constantly assessing for their safety plan because now they're being forced to be, in essence, trapped with their abuser many times. So the first thing we have to assess is, can you talk freely? Is he around? You know, unfortunately, I say he and she because that's a reality. Most of our perpetrators of partner abuse are males, and most of our victims are women. There's some exceptions, but that's why I use those terms. But we have to assess for a safety plan. Can you talk freely? Is there a number that I could call you at? And also a safe word that you agree upon to make sure that you call 911 if need be, or hang up, or whatever the case may be. But there has to be some plan involved with that, especially when you're dealing with a population like our domestic violence survivors. So those are two huge issues. And then we have the general mental health, the anxiety, individuals that can't get their medication. And like you said, right now we're seeing big discrepancies in all areas. We're seeing the discrepancies in services. Providers, you mentioned 95% of our participants are low income or no income at all. So now when they need all the resources, they don't have them. They're already difficult to access to begin with. And during this time now, we have to go into overdrive to do the case management, tap into our partners and our relationships that we have with the community members to try to get these other social determinants of health. And for example, right now, one of the biggest challenges is housing, and then the financial challenges and the emotional challenges that our families are facing. So needless to say, our staff have had their hands full during this time. And even now, we consider to see the same things at all our locations, where you see an increase in substance use disorder, an increase in violence, whether it's partner violence or just general family violence.
Now the image, thank you, Jesse. Now the image that we're sharing with you shows just prior or just around the time that some areas or workspaces started issuing stay-at-home orders, or the flexibility before we had the official stay-at-home order from our governor, and then some statistics after. So the dark blue is the statistics after or post stay-at-home orders. And as you can see, this figure indicates that women, particularly women with young children or children under the age of 18, have spiked or higher increase in mental health impact or conditions due to COVID. I would say, I guess, quarantine conditions. I mean, I would suspect that, of course, being a mother, and working from home with a child that's, being homeschooled, you have to be lunch lady, you have to be tutor, you have to, administrate, you have to be the mental health counselor for them and their school counselor. You have to do it all, basically. And I would suspect that that's part of that additional strain that women are experiencing, right? Sometimes it means that I stay up later than everyone else because I have to push some work back so that I can, stay afloat. So is this true to what you're seeing at your agency? Are you seeing more cases of women that are experiencing undue distress or anxiety due to the additional, strain on their person?
Definitely. What these national numbers are, actually, we've talked offline, and the numbers are very reflective of all our locations, because we collect data from them. We do surveys, especially during this time, to see some of these things so we could be responsive. It's the only way we could be responsive, is making sure we keep our fingers on the pulse with these kind of things. And absolutely, Lisa, that's what we are seeing, is that women, once again, the discrepancies start showing up, that they're getting affected at much higher levels than our males. Both are getting affected, but there are different issues that we're seeing with our women participants. Specifically, as I mentioned before, with the violence, domestic violence issues, and also the changes in having to deal with their children being at home and being teacher and student and learning and trying to do everything at once. It's a challenge. And so we do have gender-specific programming. Like I mentioned before, our Belmont Cragen site, those are all our trauma programming. They're specifically catered to deal with women. And then in our Armitage location is where we deal with those males that have had partner abuse in their background. They can receive services at our Armitage location to keep them separated for safety reasons, also to its best practices. So by having them separate, you clearly see the different needs that we have at our Armitage location dealing with our males and our women participants over at our Belmont Cragen location.
Thank you. And you mentioned a moment ago the impact that COVID has had in terms of people being in quarantine conditions, feeling more isolated, or feeling like the social distancing equals social isolation, and feeling that extra loneliness. And for some, it may just be, factors of fear of the uncertainty or of the unknown, or even confusion because of all of the different types of information that we are bombarded with, the numbers, as well as the mixed messages, right, that we get from the media and counter messages. And there's also a very real concern for many, right, in terms of feelings of loss, because many have lost their, their jobs and are unemployed, the financial strain, et cetera. So, and we're hearing a lot of reports that I think even in JAMA, the Journal of American Medical Association Psychiatry, recently reported that we're seeing higher numbers, or the highest numbers, of suicide since 1941. So in our history in the U.S. How what are you seeing, and what are you doing in terms of being able to provide suicide prevention services and support for the community?
So good question. And actually, so since March 15, we already have tools in place to assess suicidal ideation or homicidal ideation, either or. We have different risk assessments and scales that we're using. But what we've done since March 15th is implemented for all our participants a suicide risk assessment. Just some questions to assess safety, and also those extreme feelings of the suicidality, especially with participants that have had a history of it. So we're assessing that upon an intake. So when they first call in, we're assessing those two things. And again, on the front end, we have to make sure that the staff that are providing these services or fielding these calls, that they have the training and the competency to deal with our population. So we're assessing for both those things. If there's some red flags or there's some concerns there, then we make sure that we either connect them with the proper resources internally. In other words, that the right type of staff respond to them or connect with them, whether it's we have an APN that provides psychiatric services. And then we have our clinicians. Some are specialized in mental health, some specialize in substance use disorder, and some have competency in both to deal with both the co-occurring issues. So once we have identified somebody that needs these services, we make sure we connect them to the right staff to receive those services. And then we assess for level of care, the intensity of services. Is this somebody that would benefit from individual sessions versus group sessions? Is it going to be once a week versus 3 times a week? Home visits, initially we had interrupted those because of this, again, safety concerns, but we're starting to implement those in a couple of our sites, going back slowly to the most needed, to the clients that have the most need. Those home services we started. And so all those things we've tried doing, so multi-pronged approach to deal with the increased suicidality that we're seeing, Lisa.
Wonderful. Now, if someone is concerned about their loved one, what are your recommendations in terms of what they should do? I know sometimes it can be uncomfortable or difficult to directly approach the person that they're concerned about, whether it's a family member or a close friend. So what has been your experience in terms of what you would recommend for them to do to be supportive?
Sure. So and it depends. So a lot of times education is always great. Education for resources, and also education on the different issues, whether it's substance use, domestic violence, or mental health issues. So it depends. The most common calls that we get are, a wife or a mother that's having a son or a family member or husband that's abusing alcohol and or drugs. So those calls are difficult because if it's an adult, it's very difficult for another adult to tell them, you got to stop doing this. So a lot of the research and education revolves around self-care, but also this is the kind of questions that you can and cannot, that you can ask the person. This is the kind of communication. These are kind of some of the things to look for, and these are the resources that are available to a loved one. And then if it's somebody that's struggling with suicidal ideations or mental health, again, resources is always very beneficial, but also making sure that they have somebody they can talk to right there and then. So, somebody calls and they answer their questions. What are some of the things that you're dealing with? How are you feeling with this? How is this affecting your life? But also, provided them with the resources and to protect themselves and also to pass along to their loved ones or other family members. And it's, again, another, so we're seeing that those kind of calls, and the other kind of calls are, again, family members that witnessing or know of violence happening in their household or in their brother's or sister's household, and the sense of helpfulness of how can I help my sister who's over there with the abuser living with them? What can I do in that situation? And sometimes the situation doesn't involve calling the police, 911. But in other situations, education and resources.
Thank you. And we just wanted to share a few statistics that indicate, and this is from a study conducted by the Pew Research Center regarding Latino adults and their experience with COVID and how they perceive the COVID to be a threat to their health and personal finances. And as you can see, consistently across different areas, in comparison to the US population as a whole, Latinos have a significantly higher concern about their personal financial situation, their day-to-day life in their local community, their personal health, and where the economy is currently kind of comparable to, or actually the same as what we're seeing our overall US rates. But this just kind of highlights and some of the points that we've been echoing throughout the conversation today with Mr. Tejeda regarding the additional strain that our Latino community is experiencing as a result of COVID and how that impacts their mental health. Excuse me. We're also touching on our mental health professionals, and not just a risk in our loved ones at home who are feeling different changes or feelings of loss or other experiences that are putting a strain on their mental health and increasing suicide, but particularly mental health professionals who are sort of in the trenches, in the front lines, day to day. The additional toll that it takes on them. We recently heard the case of Dr. Laura Breen from the New York Presbyterian Allen Hospital, and she was noted as being a top emergency physician. You mentioned the wonderful things that you're doing at HOS to support your staff. Are there additional things that you're doing and along that same vein of like, how can we be a good supportive neighbor or friend to check in on and support our mental health professionals? But now thinking about staff, are you putting in some sort of checks and balances or screening indicators to say, hey, you're just really overworked and you need to, we give you the permission, or you need to take some time off?
Right. We are actually, just today, we were communicating back and forth. So there's the administrative meetings that we have 2-3 times a week. That's with all the managers and staff to check in, make sure things are going programmatically. But then we're also, for emotionally with our staff, is providing them support. There's a peer-led support group that we started this week, and that's run by staff for themselves to just go to a place, a safe place, where they can deal and discuss issues that they're dealing with. No managers, no administration. This is just peer-led support. Then, in addition to that one, we have a professional-led support group where this is one of our clinicians, a more experienced clinician from one of our sites in the suburbs, where she's leading a group that's providing support for our staff, and is as needed basis. In other words, staff, when they're feeling stressed, they could go on there and join. So it's happening once a week. Each of those is happening once a week. In addition to that, we're making sure that we're providing staff PTO, rotating, watching out for burnout, their hours, and their caseloads, making sure that the numbers don't go too high. So the managers have a big responsibility to make sure that they're managing all those things, PTO, caseloads, and then when they see one of their staff that seems a little bit different, maybe not talking as much or isolating a little bit more, check in with them. You can check and see how they're doing. You might not know what's happening with them, and give them a day off if they need it. Have somebody else do their group or their telehealth session and give them a break. So we're trying to implement those things and then make it safe for our staff to come to us if there's any issues to address this, because we are seeing it, unfortunately. We are seeing it.
Yeah, it's I think again, as I mentioned earlier, something that can kind of fall by the wayside in terms of us taking for granted that they are kind of like superheroes, right? And they wear their heart on their sleeve, and it's a selfless field where individuals just give and give and give to others. So yeah, it's important that you and your colleagues at Haas are really taking those extra measures to ensure that staff stays safe and feels supported. So thank you.
You're welcome.
We're going to also share with you, because there is hope, right? We're talking about, very serious situations, and it can make it sound even more grim, and it's difficult to hear on top of the numbers of cases that this has caused some elevated rates in suicide, anxiety, etc. But there is hope. And I think as long as we continue to build that space of community and love and support, we're going to pass this time period. The pandemic will cease. And even if things are a little bit different, as long as we are keeping in mind selflessly that we are better together, there is hope for us to continue living and enjoying life and those little things like family and friends. But in the meantime and beyond it, Chicago has some wonderful resources. Of course, Haas being, a longstanding service provider in behavioral and mental health services. So we wanted to share, again, the information for you all to reach out to Haas. If you yourself need support services, or someone that needs support services. We also have the Treatment Alternatives for Safe Communities, or TASC, as well as the Illinois Department of Public Health. And hopefully most of you are familiar with our, who are local to us, are familiar with our Call for Calm text line, 55-2020, where you can either text in English, talk to that number to receive support, or you can send a text message in Spanish, hablar, and receive support in Spanish. There's also the National Alliance on Mental Health Illness, which is a great organization that Haas is actually partnering with for one of their programs. I believe is it your living room?
Yeah, our living room. We partnered up with them for the last 2 years at our Broadview location. So 7 days a week, 365 days a year. The living room is a crisis stabilization model to provide support for anybody that's experiencing stress during this time. So they could go there, talk to a peer, sit down, relax, have a cup of coffee, and the goal is to stabilize. Instead of going to the emergency room, they could go somewhere that's trauma-informed and safe. So absolutely.
Wonderful. And so NAMI has a great crisis resource list on their website that you can visit by using the link on the screen. At the national level, we have several resources, but we also wanted to share these in particular. SAMHSA, or the Substance Abuse and Mental Health Services Administration website, offers or has a distress helpline that is also available in English and Spanish, or to English and Spanish speakers, I should say, by texting the number 66746. You can either text "talk with us" or "hablamos," or "háblanos," sorry. There is also SAMHSA's Behavioral Health Treatment Locator. So if you're looking to identify a treatment center in your area, you can use the treatment locator. Yes, it's a great resource. If you know anyone who's experiencing suicidal ideation, or you have concerns and you want to talk with someone, or you yourself are experiencing those symptoms, you can dial the National Suicide Prevention Lifeline. at 800-273-TALK. And then there's the National Latino Behavioral Health Association. They are providing amazing resources, but also they've been hosting webinars at the national level as well, providing additional resources, focusing on various aspects of mental health preventative services as well as support services. So a lot of great resources available to all of us. And now we were going to say thank you again to Mr. Jesse for all of his time and contributions today. Your wealth of knowledge and experience and expertise over the last 15 years at Haas alone, and I'm sure beyond that, has been really helpful, I think, to me, but hopefully to those of us joining us today. And we will now take some questions from our audience. Any preguntas?
How do your providers avoid emotional fatigue
Here we go.
from talking to and treating very vulnerable clients? You sort of kind of address that with your meetings and your healing peer group led, collaborative meetings. And then she also said, how do you overcome the stigma in some Latinx communities to seek mental health treatment?
Yeah, that's been ongoing for the entire 15 years I've been here. We constantly see that change, and that's an ongoing work. And we do that by providing workshops and education and partnerships in the community. So with the high schools, making sure you're involving the parents and families, and multiple opportunities for individuals to come on site to look to meet the staff. And also, it's like most things, it's multi-pronged, making sure they have the right staff in our right sites. So we want to make sure that and it's becoming more and more difficult to not only recruit, but to retain bicultural, bilingual staff, and to stick around in the agency, because the longer they're at an agency or the community, the more entrenched they are, the better they know it, the better they are at fighting some of those myths that we continue to see in the Latino and African American community. But a lot of education and knowing the community is how we're trying to tackle those myths that continue. Thanks for that question. It's actually a good question.
Yeah, that was Laura. And then Michelle said, can we receive, is the presentation available for sharing? I think Michelle was interested.
Yes, we will certainly follow up with anyone who has registered. We have your information. So we'll, over the next few days, we will compile this and forward it to all of you. And as I mentioned before too, we're going to make the recording available through YouTube. So we'll try to sync it or coordinate so that you receive that information at the same time. Okay. Any other questions?
Anything else? Feel free. You have my email address, or contact the agency. Any questions come up, or anything that you need in general, feel free to contact us. And appreciate for you joining us this afternoon.
Yes, we thank you again, Mr. Tejeda.
Thank you.
We wanted to also share some upcoming sessions. I don't see any more questions at this time, so we're going to share a little bit about what we're going to be offering over the next few weeks. And you can, there are some additional sessions that are coming together as we speak. So you can stay up to date by visiting our website with regards to other upcoming sessions. But next week on Tuesday, May 19th, from 1 to 1:30, we're going to be joined by Ms. Esther Chimarella, who is the Executive Director of the Chicago Hispanic Health Coalition. And we're going to be talking about equitable food access during COVID-19. Ms. Esther Chimarella works across the city of Chicago or the Chicagoland area, I should say, but specifically, she's very much immersed in the Pilsen community. So we're looking forward to hearing about what they're doing there to ensure food access or equitable food access. On June 4th, Thursday, June 4th, from 1 to 2, we're joined by Dr. Moctezuma Garcia, who is a professor of practice, native of Chicago, but he is currently at Tulane University School of Social Work. He's going to be talking about generally about health inequities in the Hispanic community, but with a specific lens or attention to issues in the gender and sexual minority communities. He has currently launched a needs assessment to get a better understanding as to what the experience of LGBTQ plus community is during this difficult time and how we can attend to those. I will share with you in our follow-up as well access to that link in case you have an interest in completing that or in disseminating it to others who you serve. The survey is available, or the needs assessment, I should say, is available in English and Spanish. On Thursday, June 11th, from 1 to 2, we are going to be joined by Dr. William Marty Martin, who is a clinical psychologist and an expert in sleep disturbances. He is the founder of Sesti Sleep, and he's going to talk about don't let COVID-19 worries keep you up at night. He has been developing coping strategies to help people get better, more restful sleep. I know all too well a lot of individuals across all of our communities are having difficulties with sleep during this time. So we're very excited about these upcoming conversations and hope that you can join us. Again, as I mentioned, we're going to be sharing with you a brief post-session survey following today's session. We hope that you complete it and give us some feedback about not just this session, but what future upcoming sessions would be of interest to you. What discussions do we need to be having, and what's most important and critical for us to continue to foster a healthy Latinx community and just healthy communities in general. So for suggestions, feel free to email us at info@tanomaconsulting.com. If you have additional questions for Mr. Tejeda, you can reach him at jtejeda6790@haascares.org. And we just, again, can't say thank you enough for joining us at our very first session today. It has been our pleasure to host you. We hope that you stay safe and that you remember that by you wearing a mask and staying indoors and sort of following the guidelines of the experts, you are, not just protecting yourself, but you're protecting your loved ones. And one thing, I don't know, Susana, if you want to share, because you're here with us, something that you said that was very eye-opening during a previous conversation we had this morning about how we're focusing on the number of cases and how important it is to think about the asset-based or the positive perspective of how well people are doing.
Oh, yeah. It's hi everybody. I'm Susana. I'm one of the nurses with the Illinois Hispanic Nurses Association, and I work a lot in home care and teaching nurses. And we had a chat about COVID-19, and an emphasis was being made in our conversation that 80% of cases are at home. People are positive at home, they're living at home, they're taking care of their signs and symptoms at home, they're medicating at home, they're hydrating, and we need to help them keep safe, but we also need to repeat education and repeat education, because although your symptoms could be mild or moderate and they're tolerable, you are still contagious, and but it's important to protect them and to reinforce to them that there are resources like these available and food resources out there, and ways for them to get service and care in their home while they maintain and get through this period of contagion. So more to come when we present, because I think we were working on that discussion. But let's focus on the healing aspects of the people that have and are surviving the COVID-19 pandemic.
Thank you, Susana. And I think that's just such a beautiful way to wrap up. I mean, we have to remember to just be kind and loving to one another. And that means, you know, just again, following the guidelines. You never know what someone's experiencing within their context, their lived experience, their reality. And we just have to, you know, lead with compassion, love, and kindness. Again, muchísimas gracias to Mr. Tejeda. Jesse, we are so grateful to have you on today's session. Peace and love, everyone. Thank you. Gracias.